Dr. Wells.
Awesome. Thank you guys so much for having me. Like was mentioned, I'm a general dentist, work at Wausau Smiles. We're going to go through today kind of the entire process of what dentistry looks like, what practicing it as a dentist looks like. I'm going to start off just by passing some things. I'm a very visual learner myself. I like to be a little hands-on. So I'm going to explain a couple things that I'll pass around. You guys can get a feel for some of the things we do on a daily basis. This first one looks a little bit like an athletic mouth guard, like you may see Steph Curry wearing out on the basketball court, right? Plug for all you athletes, always wear your mouth guards. But this is actually an appliance that you would wear at night. If you grind or clench your teeth, it can cause some big damage to your teeth, but also your joints. So you can take it off, you can feel it. This is a model. None of these are real cases that we're using anymore, so don't be worried you're not touching someone else's spit. Pass those around. This one's just a model of every single tooth in the mouth, minus the wisdom teeth. So I'll just leave them up here with you, and you can take a look one by one and pass them around. The next one is in a case of someone missing some teeth. So someone's missing a couple front teeth. We talked about a son taking a sledding accident in the past. This one's pretty common in hockey, almost like a badge of honor. Right? My brother-in-law is a Warrior. He won a state championship on the hockey team here at Wausau West back in 2010 or 11?
Dr. Wells went to Wausau East.
Well, I was going to bring that up later, but I am a graduate of Wausau East. Had a lot of fun beating the Warriors. It was a great time. Different times back then, though. This is a really cool model. It has examples of implants, which we'll talk about, of a root canal, of a fractured tooth, a couple different things. So you can kind of take some time to look at this. And last but not least, this is a pediatric model. This is actually of a real patient, but no longer in use right now. What this is if a young patient loses a tooth, we don't want the space where that tooth was to close, so we keep the space open with a little device. It's almost like mini braces. So those are just some things you guys can look at. If you guys have any questions at any time, please feel free to ask. I want it to be as interactive as possible for you. Something that's really exciting that we like to talk about in dentistry is coming from the U.S. News and World Report rankings, stating that the #1 best job in America, believe it or not, is being a dentist. So my goal today is to kind of explain why we hit that ranking. Although you will see, that was back in 2017. So it pains my heart to say it, but currently we've dropped down to #4. But there are a lot of reasons that I think dentistry is an awesome job. I think first and foremost, the reason that most people get into dentistry is for patient care. Dealing with people on a daily basis, helping people out is an awesome reason to get into it. My mom is a nurse, and coming out of high school, I thought I wanted to do something in medicine, do something science-based. So I went in, she worked at the hospital at the time, and I was, shadowing some surgeons, things like that, and I noticed that it was always someone else that was talking to the patients. It was never the actual, say it was a heart surgeon. It was never the heart surgeon that was talking to the patient. It was the nursing assistant, the nurse, the physician's assistant, and then the heart surgeon would go in, do the surgery, pop in for 2 minutes when the patient couldn't remember them anyway, and maybe see him for one follow-up. Patients is kind of at the center of what we do at Wausau Smiles, but at what everybody does when they're in dentistry. You can help someone by fixing their smile, which we'll talk about. You can get someone out of pain. And dental care is really, really important. Another thing that's awesome about dentistry and why I think it hits high on this list is for the family aspect of it. You kind of control your own business, your hours, your work schedule. Gives you a really good work-life balance. Although we do go in some weekends and things if patients have emergencies, a lot of times if you're working as a physician, a surgeon, you'll have on-call hours over the weekend, on-call on the holidays, things like that. For us, unless a patient has an issue, we're off, after 5 o'clock and we go back in the next day at 7 o'clock. And I currently have Fridays off, which we'll talk about later in our schedule, but I think it's just a well-rounded profession. And everything is different. It's always changing. No two patients are the same, no two fillings are the same, no two cases are the same. So you never get bored. It's always changing, and it's a really exciting profession to be in. Does anyone have any questions right off the bat about dentistry? All right, so when I bring this up, I want you guys to shout out the first thing that you notice, okay? So you guys ready? What do you guys notice right away? He's missing a tooth, but he's also missing an eyebrow. So So you guys may not have realized the eyebrow right away, right? But you noticed this tooth right off the get-go. And so I like to use this as an example of why dentistry is important, because the first thing that you're drawn to is the smile. Now obviously it's exaggerated, they're all smiling, his mouth's open wide, but this, believe it or not, was a real dental advertisement. I don't know where it came from. I just thought it was funny, because when I looked at it, the first thing, obviously being a dentist, I saw was his missing tooth. But lo and behold, if you look at his eyebrow, it's not there. So dentistry has a huge impact, and if this gentleman with an eyebrow or not went into a sales job interview, whether or not the person may admit it, I think his interview would be impacted because he's missing a front tooth. That could be a challenge, right? It can be a challenge if you're trying to find a date. It can be a challenge if you're going for a job interview. It can be just a challenge on your day-to-day self-confidence, not having that front tooth there. And so dentistry can do some special things to help replace those teeth. So like we mentioned, we come from Wausau Smiles. We're actually really close, right up the road on North 17th, kind of across the way from Triggs. And I'll introduce you to my family. So we have, obviously, myself, but then our little son, Benjamin. He's 15 months old, and you can see his two little teethers sticking through the gums there, getting into the teething stages, chewing on everything. And my wife, Ellie, she also went to Wausau East, played volleyball there. Much better athlete than I was back in the day. And what we focus on at Wausau Smiles is honestly the patient experience. Dentistry used to be a lot of, here's a cavity and I'm going to fill that cavity. And now it's a lot more about the patient experience. We want people to be there, feel welcome, feel comfortable as we can be at the dentist. So we have things like a nice waiting room, a patient beverage bar, internet kiosks. We go through in our office is as streamlined as we can make it, making it a good viewing experience with the view of the mountain, open bays, feeling as comfortable as we can at the dentist, because we want people to have a good experience. We want people to come back. Dentistry is an interesting profession because what you're actually trying to do is prevent the diseases that you're solving, right? If someone has a cavity, my goal is not to fill as many cavities as possible. My goal is to prevent as many cavities as possible and fill them when needed. There's always going to be cavities, there's always going to be gum and bone disease, things that we'll talk about, but our goal is to actually get ahead of all that and stop it from happening. So before we get into the process of becoming a dentist, does anyone have any questions about where we started? Cool thing is if we ask questions, we brought a whole bunch of awesome bouncy balls, so maybe that'll entice you guys to ask a couple more questions. So if anyone has any, let me know. But deciding to be a dentist. So I mentioned, question. See the bouncy balls I told you.
When you are a dentist, do you do all of the same things that surgeons do?
Yeah, great question. So the degree after a dentist's name is DDS, Doctor of Dental Surgery. So dentists do everything and anything. If you're talking about like an oral surgeon removing wisdom teeth, that kind of stuff, we do that on a daily basis. We kind of are the quarterback of the dental team, if you will. So if an extraction is relatively straightforward, non-complicated, we would do it at our office. If it's something that's complex, going to need the patient to be put under an IV, things like that, then we go to a surgeon. But we do everything. Great question. And nice catch. Everybody, round of applause. That was awesome. So, why dentistry? I mentioned a little bit, I like the patient interaction aspect of it. But dentistry, as you guys will see, hopefully through the presentation, is more than just science and people. It's healthcare, right? It's getting people healthy. There are so many different connections now that people are realizing between your heart health, your diabetic care, your overall systemic health that can start and end in the mouth. The better your oral health and your gum health is, the better your diabetic care will be, the better controlled your blood sugar can be. So it ropes that into it. But it's also a business. Like we said, at Wausau Smiles, Aaron and I kind of tag team it as the two dentists there, and we have a staff that we support, and they support us. We have a team. We're kind of our own bosses, but at the same time, we do what's in the best interest of our patients, do what's in the best interest of our team. It's a little bit different than, say, if you worked at Aspirus at a big hospital, where you're not the owner of the business. You don't have a lot of that decision-making power on what hours you're open, who works there, how they work there. It's a lot smaller, more close-knit staff there. And so my decision really came about when I realized that I wanted to interact with people every day. I wanted to build relationships. My goal was to come back to Wausau where I was born and raised, although you guys are at a different phase of your life. I hope you guys realize that Wausau was an awesome place to grow up, and we wanted that same experience for our son. And so all those kind of wrapped up into helping get me in the direction of dentistry. So the way I took to do it, I had to throw this in here, right? Graduated from Wausau East, class of 2007, which is crazy to say, it's almost 13 years ago now. Then went to University of Wisconsin for my undergrad. So did my 4 years at Wausau East, then went to University of Wisconsin for 4 years. In order to be a dentist, you usually, and I say usually, need a 4-year undergraduate degree. And there are questions that I can help answer at the end in terms of what you need to study, that kind of stuff when you get into college, if that's something you're interested in. But usually you need a 4-year degree. There are a couple programs that you don't. Marquette has one of them, and that's the dental school here in the state of Wisconsin. Marquette has an early entrance program that you actually apply for after high school. If you know dentistry is what you want to do straight out of high school, you can apply for an advanced track program. So you would go to Marquette for your undergraduate degree, but then you get into dental school early. The benefit of that is less years of undergrad and less cost of your education, which is a huge benefit. I did not go that route though. I went to Wisconsin for 4 years and then crossed the interstate battle yet again and went to Marquette for my dental school. Marquette, for those of you who don't know, is down in Milwaukee. It is an awesome college right downtown Milwaukee. It has a lot of big benefits, but it's also the state's only dental school. Other dental schools in the area, Minnesota has a really good dental school, Iowa has a dental school, Chicago has a couple dental schools, but those are the ones that are close. And then you can go anywhere as crazy as California, East Coast, Boston has a ton of dental schools. I mean, there are a lot of different opportunities for dental education. But high school degree, 4 years of undergraduate, and then dental school is 4 years. The main difference between dental school and medical school, in my opinion, not only obviously are you working on a different area of the body, but when you're done with dental school after your 4 years of dental school, you can go out and start practicing dentistry. Medicine, you do your 4 years of medical school, but then you're required to go on to a residency. So if you want to be a family practicing physician, you need to go to like an additional 3-year residency after your 4 years of med school, after your 4 years of school, after your 4 years of high school. So you end up getting into quite a few years to get your degree to be a physician.
Are there any like prerequisites to get into dental school?
Great question. So there are a good amount of prerequisites to get into dental school, and that kind of guides your path when you're in undergraduate. So when you're in undergraduate, what they call declare a major. And so say you know you want to go into dentistry. My major was biology, which is just study of human systems, right? But you focus on biology because that's going to knock out all your prerequisites for dental school, but also get you the degree in biology from the university. So you kind of have two different goals at the same time. I serve on the admissions committee down at Marquette, which means I interview the kids that are coming in and trying to get into dental school. And I've seen people with classics majors, like study of classic literature. I've seen people with music majors. Seen people with physical education, kinesiology majors. Seen nursing majors. We had a pharmacist in our class who decided he didn't want to do pharmacy and he'd rather be a dentist. He was already done with his whole pharmacy track. But to answer your question, the short version, yes, there's a track that you would go on. It's very similar if you wanted to go into medicine, veterinary, that kind of stuff. Another question?
So you said that you're like on the board. So if you're like looking at an application and say you have like 4 applicants all with like a biology degree, and then you have the one who has like maybe a background in like, I don't know, physics or something, and they want to go into dentistry, does that like stick out? Do you guys like having a majority of backgrounds, or did dentistries just look for like one?
Good question. I think that my answer, and I would say, is probably pretty similar. Nice catch. We're 3 for 3, guys. There's a lot of pressure right now on catching. I would say my answer is probably a little bit, maybe, I would hope on par with the admission director at Marquette. I would say, I don't think it's better or worse. I think it's exactly equal. You'll have to take very similar prereqs. So the challenging part about being a music major is then you also have to get all those science classes. Whereas as a biology major, those are all included in your major. But I think it does make a well-rounded individual to go out and do other things. That's kind of encompassed in some of the extracurriculars, you know, going out, getting involved. I did a lot of Red Cross Blood Bank volunteering when I was in undergrad. Just kind of going out and getting those additional things that you want to have on an application. But I don't think it helps or hurts. I just think it's different. Good question. And we'll talk a little bit more kind of about the requirements here in applying for dental school. So when I went for dental school, keep in mind dental school is after undergrad, but I went to the university, well, I guess we'll call it The Ohio State University, right? So I went and interviewed at The Ohio State University, and the first thing they said is, congratulations, you guys got an interview at Ohio State, that's awesome, you guys did really good to get here. How we selected our candidates is 40% of your application was based on your grades, 40% of your application was based on your entrance exam, and then 20% of your application was based on everything else. So meaning 40% grades for your 4 years, 40% on your standardized testing, and there's an entrance exam for dental school, kind of like there is for like the SAT or the ACT, and then 20% on everything else. So the reason I bring this up is when you think about all healthcare degrees, they're pretty focused on metrics to get you in. So if you want to be a veterinarian, if you want to be a nurse, if you want to be a physical therapist, if you want to be anything really in the healthcare field, you really want to start strong academically, not only in high school, but after high school as well. And so the first couple semesters of college are super important because getting straight A's in your first couple semesters of college sets you up a lot easier than getting C's in your first couple semesters at college and trying to have to get that GPA back up. Because a lot of the times what you're going to be doing is interviewing after your 3rd year of undergrad. So that means after your undergrad, when you're done with your 4th year, you'll already be admitted to dental school. So you really only have 3 years if you take a traditional path getting into school. And the reason I bring that up is it's just always easier to start well than to catch up afterwards. And so something that's important as you go. Any questions before we jump into actual dental school?
So looking at this, they have something sort of like this at the tech. So is that for dental, that's like the hygienist?
Great question. Would you like the one?
No, good.
I figure maybe you want one out. So they do have a hygiene program here at the Tech. And so hygiene is a little bit different than dentistry, and that's a great question to ask. So dental hygienists focus on basically cleaning and restoring the teeth. A lot of times if you don't have any cavities, fillings, crowns that need to be done, you'll see the hygienist probably as much if not more than the dentist, where you go back a couple times a year to get your teeth cleaned. That's a 2-year degree after high school. It's an awesome degree. Our hygienists are amazing people. And they are just as important, if not more so, in keeping teeth healthy than I am. Like we said, we like to prevent the disease from the get-go rather than allowing it to progress. So if we can prevent gum and bone disease, prevent cavities by having people visit with those hygienists and getting that side of things, it's very, very important. So what you would do if you wanted to be a dental hygienist is you would go through high school and then you'd apply for their program. It's a 2-year associate's degree. There's some coursework associated with that, but there's also some hands-on work. And so what you can actually see these students doing, these are dental school students, but they're doing the same hygiene procedures. So our first year, we do get trained in all of the same things that the hygienists get trained in terms of cleaning the teeth, restoring the teeth. There aren't very many practices that do things this way, but I could do everything in the office if I wanted to. It's just the hygienists are honestly way better at it now than I am. They're way better at taking care of the teeth and cleaning them, and I'm way better at doing the other parts of dentistry, fillings, crowns, extractions, that kind of stuff. So we utilize everybody to their fullest strengths. But a 2-year program after high school for dental hygiene, awesome career, and I'm happy to talk more about that if you guys want to know more about that. What you'll see here though is we call this the simulation clinic. So at Marquette, we do a heavy amount of simulation clinic in the first couple years of school, as most schools do. And then you slowly transition up in school to working on real patients. I remember calling my dad the first patient I saw in dental school when I was like freaking out as for cleaning. I was like, I'm actually going to be in someone's face. Like that's kind of interesting to think about, right? But as you go, the mouth kind of, one mouth is one mouth is one mouth. You kind of separate a little bit and get used to it. And I always joke with my mom, she was a nurse in the GI department, and I always said, well, at least our end is nice and healthy up here. So there are definitely worse spots to be in healthcare, but I think for the most part, people really do take pride in care of their mouth, and so that helps, especially right before they come to the dentist. Everybody's brushing away and flossing for a couple of weeks right before they see us. In dental school though, dental school is 4 of my favorite years, I think, partially because, as you know, in high school, you guys have a ton of classmates here, so many different people, and that's a great experience. When I went to Wisconsin, I think there were 42,000 people going there at the same time I was. I mean, huge classes, class lectures of 500 kids. Sometimes you walk from one class to another and you wouldn't maybe know anybody, but then you get home and you get with your friends and it was a great time. But in dental school, we had 80 people, and every single day from 8 a.m. to 5 p.m. we were with those same 80 people going through the exact same thing. Every single test we had together, every single practical we had together, every single licensure exam we had together. I mean, we did everything together nonstop. And so the reason it's so special to me is, again, more for the people. Like I mentioned, it is a 4-year process, so you start off in your first couple years down in the simulation clinic, and you'll just really start honing your skills. And here's a picture of what we affectionately call the Stab Lab at Marquette. My friend John, you'll see him in another picture coming up here, but he was a selfie master. So this is actually him taking a selfie of when I was giving him one of our first injections. Funny joke about that is, while he wasn't paying attention, there are some shorter acting anesthetics that'll keep your jaw numb for like an hour or two, and some long acting ones that'll keep your jaw numb for like 12 hours. And I swapped it in and did a 12-hour anesthetic for him, which he found out that evening when he texted me. He's like, dude, what did you do to me? So it's a little bit of fun as well, but this is us getting each other numb and just practicing, and that's kind of how we do things. You don't practice fillings on each other, you don't practice crowns on each other, you don't practice things that are unnecessary. But it's really important for us to know how it feels for the patient in the chair when we're doing this kind of work. And so this is a way that we kind of get acquainted with that in dental school. And if I'm not mistaken, we actually, as weird as it sounds, we're going in for extra practice at this time, because you really need to make sure to get people comfortable while you're doing the dental work. It's something that people are very afraid of, and so we take it as seriously as it sounds with all my joking. So we practice in the sim lab, we practice on each other, but then we do graduate up into the dental school clinic. And the reason that we get patients at the dental school is, at the dental school, the treatment's a little bit discounted for being at an educational institution. The other thing at the dental school that's a little bit challenging for patients is the appointments are a lot longer. So right now at Wassa Smiles, if I wanted to do a crown, I would book out about an hour of my time to get a crown done for a patient. At the dental school, a crown is probably a 3-hour appointment. So it's a lot longer time, but it's also discounted in price, and we also have people at the dental school giving us what we call start checks, a professor coming in, making sure what we're doing is the right tooth, the right area, how our numbing is correct, everything is correct. Then we get everything ready, we have them do what's called a prep check or a preparation check, where they can see our work, make sure everything looks really good, that we're not running into any roadblocks. And then before that patient exits the door, another check from the same dentist, so the person's coming in 3 additional times. It takes a little bit of time, but it really hones your skills, having someone looking over your shoulder that whole process, doing that with you. All the while, what we're kind of blending at Marquette is we're blending hand skills with your book work. So, although it sounds like a lot of schooling going 8 to 5, kind of like what you guys have here, about half to 2/3 of that time is down in that simulation clinic, working on models, doing the different aspects of dentistry that we'll talk about later. There's fillings, crowns, dentures, pediatric dentistry, root canals, all those different things you really need to learn before you start going into people's mouths. Yeah?
Is it, so you said pediatric, is that a separate degree or learning than just a regular degree like CBEL?
Very good question. So it is not a separate degree. So pediatric dentists are dentists, but what we'll talk about in a little bit is they do go through an additional year or 2 of training. Each program's a little bit different, but they specialize in kind of pediatric